Well, we're in Westminster here today to put your questions on public health to the parties during the election, and we're very lucky to have with us Norman Lamb, who's the Shadow Health Secretary for the Liberal Democrats. Norman, thank you very much for your time and for joining us here today. Now, Norman, all the parties are making health a big issue in the forthcoming election, but in such difficult financial times, how would you ensure that health prevention still gets the funding it needs?
Well, first of all, I don't think it gets the funding it needs now. I think there's been far too much emphasis on repairing the damage, as it were, rather than preventing ill health in the first place. And we don't ensure that the money gets through to prevention. And so what I would do is to reform the way the money works in the NHS to, for example, incentivise the commissioners, the local primary care trust, to really get engaged in health and well-being of their communities. So that means that the money coming from government, you get extra money, in effect, if you engage with councils, with employers, with voluntary groups, with youngsters, to really develop plans for improving health and well-being in your communities, particularly in disadvantaged communities. Now, there's no incentive of that sort at the moment. You get particular chunks of money for particular initiatives, but it doesn't work effectively. The money gets sucked into acute hospitals and we don't invest sufficiently in prevention. You could make a real difference by changing the money flows in that way. We should also incentivise GPs better to really achieve results on prevention, to get their patients to stop smoking, for example, to get their patients to lose weight. At the moment, the payments are too much tied to processes that the GP goes through, measuring the weight of the patient, telling the patient that it would be wise to give up smoking, and so forth. Pay them to achieve results would be much better.
Now, another issue that comes up particularly for us is childhood obesity, which you'll know is a major issue in the UK and particularly in the North West. How would you tackle that issue if you're successful in the forthcoming election?
Well, I've focused particularly on activity. We have seen over the last 2 decades or so a much more sedentary lifestyle, much less activity. All too often school has diminished, sport has diminished in school and outside school. So, I mean, as a parent myself who's had 2 boys going through local football, I would just want to ensure that there are the facilities there to really engage youngsters in sport and also other activities. You mustn't be, restrictive in what you offer. There should be a whole range. Many youngsters just don't want to get involved in football or rugby or whatever, but let's provide opportunities, and again ensuring that we operate in the poorest communities and working with the Fitness Industry Association, the people who run the sports centres, the gyms and so forth. There's a lot of spare capacity there, particularly during the day. If we're smart, we can make use of that spare capacity with joint initiatives between government and private industry to make facilities available for people who otherwise couldn't afford it.
Moving on to the issue of alcohol, another major issue as you know, how would you tackle the rising tide of alcohol harm? And in particular, would you support the idea of a minimum unit price for alcohol?
Yeah, we would. The Liberal Democrats have been very clear on this. The Chief Medical Officer has specifically advised the government to introduce minimum pricing. The government has ignored that advice, and we say we should follow it. This is to address the problem of dirt cheap prices in supermarkets for both spirits, vodka for example, which is often a drink of choice of youngsters, and not to attack the pubs, the community pubs, which are not selling alcohol on the whole particularly cheaply. So a minimum price addresses the problem where it is without damaging the responsible part of the industry, which is an important part of a local community.
Now, in terms of tobacco, there's been a lot of changes in terms of tobacco regulation in recent years, but would you go further, in particular, to stop the tobacco industry targeting children and young people? Well,
we've introduced in this Parliament, and we supported the government on this, the capacity to ban vending machines, and the regulations are going through to implement that, and I supported that personally. We know that youngsters were getting tobacco through vending machines, and so I think that's an important measure in itself. I also think it would be an important step to do much more to tighten up on illegal tobacco smuggled into the country, because often that's where it's being bought very cheaply, often by youngsters on estates, in the pub or whatever. And it's no good having all sorts of constraints on the sale of tobacco in shops if people are accessing it much more cheaply through the local pub or off the back of a lorry. So we've got to be much more effective at stopping those illegal imports.
And finally, if you could propose one piece of legislation or one major measure that you think would make a real difference on public health, what would that be?
I'm not sure it would be necessarily a particular legislative measure. It's about getting the local health board, we would call it, we wouldn't call it a primary care trust, nobody knows what that means, getting them engaged in prevention, working with councils, working with employers. There's such an enormous potential. You see the best practice in companies where they really focus on the health and well-being of their workforce and their families, and you see dramatic improvements, and it benefits the company, it improves their bottom line, much lower sickness absence. But these are isolated examples still. If you could get the health boards really working with local employers and with councils in improving the town and city landscape, introducing cycle lanes and so forth, then you could transform the health of our communities. And the critical thing is you then reduce the burden of cost on the NHS in the long run, but you make life better for people.
Norman Lamb, thank you very much for your time
Thanks
today.
a lot. Pleasure.
Thank you.